this mask, okay, which gives you PEEP and FiO2 as you want. Okay, now this will give, again I forgot my glasses, this will give you at 60 liters per minute, let's say for 40% FiO2 at 5 PEEP. Okay, they have already given you semua untuk calculation semua dia dah bagi. Edison, can I have a pen? Okay, never. They will give you all the calculations here, which I'll pass around. You guys can have a look. All right. So let's say the patient requires PEEP in the ambulance itself. You just pass on this. Okay, so that is why the pre-hospital care guys are already giving this. Another disclaimer: this is mechanical. Okay. It will tell you later when I pass around, you guys see there are wordings here 5, 10, 15, you know, the PEEP. Okay? But this is useless. This is useless because this is a mechanical PEEP. Okay? The actual PEEP which the patient is getting is shown in the manometer here. Okay? Now the reason why I'm telling you guys this, alright? I'm talking about pre-hospital care so much, right? This was initially meant for pre-hospital care. Then what I realized was this, and correct me if I'm wrong, doctors, yeah? Let's say now your patient, you're going to wean off the patient, okay? Let's say from BPAP, you're going to put him to Cpap, you're going to send him down to the ward, all right? Do you guys send the patient down with machines? A BPAP, Cpap machine, or any kind of machine to the ward? And how do you wean off the patient? How do you send the patient down for Cpap in the ward? You don't send patient? You just send them with venti mask. Okay, this is good because some hospitals do actually send with the machines, yeah? And the machines too, by the time the machine comes back up, you're not even sure if the machine is still, you know, because not everybody know how to operate the machine, right? Okay, without mentioning names. Now, I have been telling the ICUs, when you want to send the patient down, might as well you send your test. You know what's the PEEP you're going to give, you know what's the FiO2 which you're going to give, you know, just put it on the patient, send him down, and pass on the wall. Alright? I'm going to show you guys. You need to take the camera. This is a venturi. Venturi is noisy. Okay? There is A and B. A is the biru, B is the putih. Okay? A is venturi and B is after the venturi. Now, they are saying here for 40% FiO2, A buka 7, B buka 10. So now, I don't have a double flow meter. I have got one. This will work very well for a pre-hospital care. Okay? We want to give the flow PEEP. We want to bring him to the hospital and then we just pass him to the hospital will know what to do. Correct? But in the ICU, I'm going to strongly suggest you have to use both. Okay, you have to use both. You know, you need to maintain the patient. Now, when we put this in, okay, I don't have a 7. Okay, I have a 6 and an 8 here. Okay, so I'm going to put an 8. When I put an 8, you guys see the manometer, yeah? The PEEP, I've left it at 5. So when the patient breathes, you see the manometer going up and down? So this is the actual PEEP which the patient is getting. Okay, if I want to increase, I increase, and when I increase, when I pass later, you all have a look now, yeah? They will tell you increase the flow. So when I increase the flow and I increase the PEEP, the mechanical PEEP, you see? Did the PEEP increase? Okay? So you know exactly what is the FiO2 you're giving and what is the PEEP you're giving to the patient. Okay? Now this is life made easy for everybody. I want you to just have a tengok dulu. Can I just pass it to the OB? No, okay. Okay.
Macam mana nak Android tak biasa nak with the camera.
Sorry?
How do you adjust the mechanical pit? Maksudnya,
Okay, I tell you what, because yesterday when I was in KT, I was not allowed to use it on any Muslims because they are fasting. Okay, so I cannot really show you here.
Actually oksigen boleh.
Oxygen boleh? Are you sure?
Yep.
Very sure?
Betul, tak batal pun.
Kenapa pula fasting tak boleh nak
Don't know, yesterday KT they just refused me to do anything, so I did not do. Oxygen okay.
How do you strap to patient?
The strap is there, doctor. There is a usual strap. Did you bring the strap? Did you bring the strap?
No.
Okay, they look. Never mind, it's fine. Okay, if you don't mind, can you sit down? Okay, I'll show it to you. You sure that what time? Because I was very worried when they told me this yesterday.
So basically you need a double flow.
Double flow meter?
You got a double flow.
Ada tu banyak.
Or through the wall lah.
Yes.
Dekat ni tak ada lah.
Dekat ni tak ada. Dekat ni tak ada. That is why for pre-hospital, there is no choice we have to use one. Okay? So, doctor, what I'm going to do is, I'm going to give him a 5 pip. But the flow, I'm not sure how much I'm giving. The reason is, to get the actual flow, I need to use both. Okay? Now, go ahead. This is a mask. So before we put on any patient, oxygen has to be running. Okay. Put it on, hold it tight. Okay. Turn this side. See over there? He's breathing here. Okay? Dia ada 8 ni sekarang. Saya tak pakai selimut water, okay? 6, okay. So, if I reduce it, okay? Alright? So, because this one cannot tell me how much I'm giving him. Because this is mechanical. Yes. So, if I want to increase, let's say I want to give him 10 now, I'm going to give you 10 pip, just sabar, Okay? It's going to go up to 10. Alright. Okay, so then I'm going to reduce it back. Okay, take it up. So that's how it works. You know? That's how it works.
What's the flow of the oxygen?
6 liters.
6 liters. 60.
But we are not giving 60, doctor, in this case. The reason is because 60, we require the dual flow meter. We require the dual. So here, we are not giving at 60. For sure, we are giving lesser than that.
You know, it seems like the high flow is similar, no? We are
Yes.
using a high flow oxygen plus the air.
Yes.
So it constantly it will drain the oxygen from the VID, you know.
Okay.
So that's why high flow secondary we are not really put education on that high flow secondary.
Betul.
Right. So this one is like mechanical, it's physics, basically it's a physics. Right?
Yes.
So you close one part of the valve
Yes.
that increase the pit for the patient.
That's right.
So if you remember 20 or 30 years ago we have a big balloon
Betul.
for a pit, same principle. Right? So we just put in oxygen inside there and then
I'm going to show you the balloon, doctor.
yeah.
I'm actually going to show you. No, my one is a different kind of a balloon. Okay, the reason, doctor, let me go back to the pre-hospital care tadi, Okay, now, this does not happen here. Okay, but for me to explain that is the best to explain.
Yeah.
So doctor, if let's say the patient is on this, okay, kita nak ambil history from the patient, it's almost impossible. Patient is not going to open his mouth and talk. Because CPAP just pumps you with air. You like it, you don't like it, CPAP just going to pump you with air. Okay? Hence, doctor, this is the balloon.
Okay.
Okay? Now, this one, I know for a fact that the ED fellas like it a lot. Okay? But is it suitable for ICU? This version may not be. Okay? Because this is a CPAP version of it.
Yeah.
But the BPAP version of it may be more suitable here. Okay? So, you see, doctors, with that, you want the patient to communicate back with you, memang tak boleh lah.
Yeah.
With this, the patient can actually talk to you. The patient can pakai cermin mata, the patient can baca, the patient can do anything he or she wants to do.
Oh,
Yes. So,
Well, I mean, it's not that the balloon is not like this.
okay, a little besar, yes.
Yeah, yeah. That one is like okay.
Yeah. So, same concept, absolutely same concept, this one. Okay? Relax, relax. So again, doctors, nurses, the most important thing here which you need to understand, this is a CPAP mask. Okay? You remember high flow tadi is a CPAP mask of a different interface. That is a CPAP mask, a different interface. This is also a mask of a different interface. This is also a mask of a different interface. Before we put on the patient, pastikan O2 is running. Because patient dah lemas kat situ. And kita masuk lagi kat sini, dia lagi lemas dia.
Okay.
Alright? So, I mean, I keep on telling this because that's how we will learn, kan? Okay. Same concept. Dulu, the helmet requires 2 person. Sekarang, the helmet requires 1 person. To pasang. Dah betul. Oh. You see, now there is a lot of leak which is happening. Okay? So, there's no 7, so I'm just going to up a bit. You see the leak here, so big, eh? So they have already given you this. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Breathe in, breathe out. I'm going to increase the PEEP, okay? I'm going to increase the PEEP. I'm going to increase the PEEP.
Okay, lagi ke?
So, you see guys, just now, if I want to ask the patient wearing this mask, Eddie, kau sahur apa pagi tadi?
Biryani.
Apa pagi kau belum biryani? Okay, so patient will still communicate back to you. The PEEP is maintained. Okay, I don't have a pen. My apologies. Turn this side. Turn this side. Turn this side. Turn this side. Okay. Again, this is mechanical. Okay, this is the actual PEEP which the patient is getting. All right. If I want to increase, I'm going to increase the PEEP. Okay. You see the PEEP increases. Okay. So what we want is maintained. All right. Patient will be more compliant because patient boleh cakap, patient boleh baca, patient boleh buat apa-apa. Tetapi you have to remember this. In our normal venti mask, there is no this bunyi. Okay? This bunyi, if the patient is very cooperative to you, this bunyi may be something which is not nice to him. But after a certain period of time, which I cannot define, the patient will get used to it. Macam kita naik aeroplane lah kan? Okay, you know the difference of pressure and all that, feeling kita dengung, you know, then lepas tu stabilizers. So that is what will happen. Okay, the difference is this. Okay, the difference between that mask and this mask is just a different interface. This is more comfortable. Okay, when I first brought this in the year 2013, I remember I was the first guy to say I'm not going to sell this because we have been telling our children don't put plastic bag over your head, and now I'm telling you put plastic bag over your head. Can we just remove this? Any questions? Dah lama sangat, sorry aku lupa.
Dia compliant.
He's very compliant. No choice. Now you want to celebrate. Hey, bring. Okay. I have seen patient. I can show you pictures. Okay. There was one patient in H-star in the ED. Okay. I was waiting for the entire day. No patient. So then I said bye bye. I started the car. You know how difficult it is to get a parking in H-star, right? Started the car. Went up. Sampai Shell. Like from H-star to Shell. Not very far. Eh, ada patient lah. Ada patient. Okay. I went back. Alright, I'll show you the pictures later. That pakcik was wearing a mask. He was like absolutely disgusted with everybody. You know? So then the doctors were like, dia tak nak pakai. So I went, okay, come, let's talk. I went to the wife, I explained to the wife. And the wife is telling me, it's not me, he needs to agree. I went to the pakcik. Only thing I said, pakcik boleh cakap lah. Pakcik nak cakap lah. Kalau saya pasang ni, pakcik boleh cakap lah. Yeah. Immediately he agreed. I'll show you pictures. Okay? Wow. Sometimes I'm amazed at how fast my phone messages are coming. Okay. This was at 4:08 p.m. He was absolutely disgusted with everybody. Okay? This was at 4:22 p.m. Look at our friend smiling. Yes, it's the inventors are the same. Dia brand, yeah. Okay, so patient compliance increases for sure, and hence our therapy will meet his needs, his or her needs. Okay, now you see this dead space dipsol. Okay, this cannot be used as a BPAP or with any of your machines. Okay, because the dead space is way too big. Hence, there is another version. Okay. An NIMV version. This is to be used with your ventilators. Okay. Now, sekarang ni ventilator dia ada setting helmet. The newer ventilators. So you put this on. Okay, you put this on. Now this one is a little bit different. This one is a little bit different. You see the dead space? Kecil kan? Cute, very cute. And to pasangkan dia, open the top first. Okay, and to pasang here, satu orang tak boleh, kena dua orang. Alright. So doctor, do me a favor. You pull the plastic. Pull as hard as you can. You pull this, put it inside the patient. Okay? Okay, then thanks. The moment the patient is inside, don't close this first. On oxygen, that is why dia dah bagi banyak-banyak ni. Okay? Certain way. See, Mat Saleh ni, dia suka inspiration, expiration. Kita pula, we want to use the dual limb to make life easy. I mean, I agree with you all lah. Kan? So kita pakai satu je. If you want to nap the patient, there is also a net device which is already given. Okay, so after you have on the ventilator, this zip, benda ni buatan Itali. The zip is buatan Japan.
Okay.
Very, very, very expensive, very ketat. The moment you see to tarik dia pun dia dah bagi mechanism dia, you see this? Okay, you tarik dia until the end. Tak ada patient dalam susah. Okay, you have to go till the end. Dia akan automatically inflate. Alright? If you want to feed the patient, because this is not suitable for pre-hospital care or the emergency use. Not suitable. This is more for ICU. Okay? If you want to feed the patient nak makan. Because patient on this mask is a patient who is conscious. Right? Patient nak makan, patient nak minum. All you need to do is, don't touch your ventilator. You want to feed him? Bukan. Bagi dia makan, bagi dia minum, apa benda dia nak buat. And then, close it back. I told you all the advantages. I'm going to tell you one disadvantage which I have seen. Bila patient muntah. Okay? Bila patient muntah in a Cpap mask, that flow will be zzz, zzz, zzz. When a patient muntah in a BPAP mask, that one even better. Bila dia whoop, you lepas itu. Okay, I mean that's how the machine works, kan? Alright? So that's the only disadvantage which I have seen. Okay? What happens if the electricity goes off? Kita ada backup. Okay, what happens if the oxygen finishes? Okay, in a ventilator, I'm not worried. Okay, because that flow is going to be giving you the amount of noise, everybody is going to be awake. Alright? But what happens when you use this or you use any mask and the oxygen finishes? You see this lubang here? Okay, kenapa susah-susah ni? Nah. You see this lubang here? This is where the CO2 comes out. Okay? And you heard the noise just now, right? The number one indication is there's no more noise. Number two, don't worry. The CO2 still goes up from here. But, I'm giving you less than 30 minutes. Okay? After that, definitely poisoning. For sure. For sure. That is another disadvantage. Alright? Any questions?
So let's say the oxygen finish, then there's no supply of oxygen. So where's the patient get the is there any entrainment system that can no? So it's breathing through the that bag lah.
The moment the oxygen runs out, especially when you're in an ambulance, okay, I would suggest take it out. I'm going to immediately suggest take it out. Because you see, in a pre-hospital setup, we are looking at the PEEP. And if we cannot give the PEEP, we are going to put the patient on more distress. Might as well we just take it out. That's why I always train the paramedics.
Okay.
But doctor, for your emergency setup too, I'm not sure whether mask is that mask. Not this is not suitable for ICU. Absolutely not. Okay? But that one, if you're going to wean off, you're going to send the patient to the ward, yes. Memang berbalik with that. Okay, it's very good. And if you have patients, not if, I'm sure you have patients, okay? You want to try this? Doctor, I'm willing to give you the sample.
Okay, Dr. Teacher.
Yeah, I'm willing to give you the sample. I'm willing to come and teach you guys how to set up. I'm not going to give you this sebab benda ni dah keluar masuk banyak kali. Okay, I'll give you a new one. Okay, I'll give you a new one. We can put it.
Are you different size?
Yes.
Different size.
Yes. Yeah, the S, M, L, XL. In Malaysia, okay, we only buy M and L.
M and L.
Yes. S is too small. XL is too big.
Ni apa?
The pot, there's a 6 pot there. So If you use
Just
one, the other one,
semua tutup.
the rest is a close.
The rest is closed. So you see, only one is open, the rest is closed. So if you want, you can open it. If you want to put any net, ke apa ke, everything is already here.
Single use
Okay. So the thing is, sepatutnya single use, tapi kita sehingga boleh use.
Every product is like
Yes, because it's expensive. It's expensive.
C3.
Doctor, next week I'm actually coming back here for another CME. I'm not sure when.
Yeah.
On
ED department.
yes. So when I am coming, I will bring over.
For that, I need to confirm whether my ventilator can
What ventilator are you using?
handle
Boleh. You're using C1.
C1 ada, C3 ada,
T1 apa ada?
E1 ada.
Semua tiga boleh?
Then
Semua tiga? Yeah. I work very well with the yeah. Okay, so I will give you all and we will set it up together. Okay. So before I go on to invasive, okay, I'm still in non-invasive. So doctors, I have been carrying this. I forget I'm online. Okay, I have been carrying this for the past 7-8 years. Tapi saya tak promote sehingga tahun ni. The reason is this. I do not want to compete with Respironic. Why do I want to compete with Respironic? I'm not going to win. Okay? But Respironic now has got a global issue whereby they cannot supply. Okay? They have even given letters to the hospital saying that they cannot supply. Hence, I told my guys, okay, let's do this. This is a BPAP mask. Again, I told you, Mak Saleh ni dia suka double. Okay, dia suka double. Kita nak single. So, the stock which is coming in to me right now, single je. Kita bagi single dengan 3 female. Alright? The difference is this. Try doing this with any mask. Cannot, kan? This has been made very flexible. Okay? And there are studies which was done, especially in University of Milan, which says when we put BPAP, Cpap tadi, if you realize, BPAP is going to go zzz, 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 kan? So the mask tu pun zzz, 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 zzz lah kan? Alright? Now, there are studies to be done, and they say that the fifth strap, which is right here, this is patented, and this company is the only company in the world has it. Okay, it reduces the movement, hence reduces the leak, hence increases the therapy of success. Okay, it's been given. I told you all the advantages, kan? I'll tell you the disadvantage now. Disadvantage is no, it's not lembut betul, dia keras. Tapi the velcro, after you use 5, 6, 7, 8, 9 times, that is the only disadvantage which we have, which I'm trying to get the manufacturers to say, sama macam yang mask tadi tu, gunalah plastik. Okay, but they are saying, they gave me a very good answer. How long are you going to put the Cpap on? Because that is meant for pre-hospital and you know, at a later stage of weaning off, right? This one, the patient is going to be on for a long time. So they're asking me, if you put plastic tu kan kita tarik, kita nak bagi dia ketat, you know, patient is uncomfortable. So hence, they keep on telling me that this is still the best. So then I told them, kalau korang ni boleh buat macam ni, dekat hujung-hujung ni, buatlah dekat sini pun, you know, dan kita tarik je lah. Okay, so they are considering that right now. Okay, they are considering that, but I'm telling you, this is cheap. It is okay. This is re-sterilable. This is re-sterilable, autoclavable 10 times. They have given you the list. Setiap kali tu kita kena chop. Okay, I am going to tell you, jangan autoclave. I promise you, kali ke 11 hancur. Mak Salih dah fikir dah? So cold sterilizer. Just put it into the high level disinfectants and take it out because it's the same. Whether you're going to burn it or you're going to put it in a cold sterilization, it's the same. You know? So do not autoclave. Alright? Any questions, ask me again. ETCO2, whatever other wires which is coming, NGT, whatever which is coming, here. Ada pot dia. Okay? ETCO2, here.
Compatible to any machine.
Any machine.
Nap can do this.
Yes. There is another version to this. Okay? This is called the Dmax. There is another version which is called the Dmax Zero. And they tell you there is almost 0% CO2 rebreathing in that version. Tapi kan doktor, harga dia boleh tahan. So saya tak bawa masuk. Which low part kan?
Ini tak ada apa.
Ini tak ada apa. Ini yang akan datang ni memang tak ada dah. Low
Double
part.
rim. Kita dah beli, kita pakai single rim. This one kena buka lah, is it?
Yes, it is
CO2.
okay.
You have to open.
Yes.
Hah? Tak, ke sini.
No, correct. Doctor, full face. Sampai mata. Tapi ini tak cukup, ini S. Kenapa kau buat S?
Itu yang ada, yang sampel ada.
I ingatkan dia berhidung je.
Tak. Full. Yang hidung pun ada. Who is the smallest person here?
No lah.
What actually? No, don't take out the mask. Don't take out mask.
Atas mata.
Muat deh.
Tapi ni boleh lain.
Oh.
Tak muat. Tina buat kot. Tina buat. Tina's face also something like you're wrong.
Okay, doctors. While you're seeing that, you guys can have a look at this juga, the bike. Okay. So I am done with non-invasive. Okay. Any questions on non-invasive? Boleh ke? Boleh ke? Boleh. Come, I'll prove it to you. Come, I'll prove it to you. Come. You want to try? No. Now I'm going to put this without oxygen, yes, but I got no ventilator. You want that? I can put it for you later. Okay. Okay, relax, relax.
Tak nampak relax tu. Toy Story box. Toy Story. Oh ya, the pink color kotak.
Kalau zip tengok muat grey kan. Tak payah zip.
Tapi tak ada oksigen.
Tak ada zip betul-betul lah. Zip betul-betul.
Kita boleh buka.
Jangan aku semua.
Sini. No. Once it's inflated, you'll be fine.
Oh dia, itu.
Hold on. You hold on. You relax. Sorry. Okay, come. Tarik keluar. Front. Patient yang pakai tudung always to the front. Patient yang pakai tudung always to the front, not to the back. You want to try the Cpap one? Now, you see, doctors, very importantly, I'm telling you, okay? This is to come in contact with the skin. Okay? I'm going to show you how it's going to work with the pulo. Doctor, be very careful. Be very, very careful. So, doctor, this is a Cpap mask. This is a Cpap mask.
Saya buka dulu.
Yeah. Buka 8 ada. Yes. Perfect.
Dia tak kembang.
Kejap je. Okay, okay. Kita kena strap dulu. Nanti di kumpulan.
Baru di sana.
Yes.
Sampai habis.
Sampai habis, okay? Sampai habis. Now, you see, this is not kembang. Okay? So there is a major leak somewhere. So where is it leaking? The pit ada tapi dia tak naik. So sorry doctor You see? Okay, doctor ketatkan lagi doctor because there's still I can put in 2 fingers. Ketatkan lagi. Okay. Alright. Okay. They're getting it.
Ketat tak?
Tak fast itu.
Ketat tak?
Ketat dah doctor. Ketat. So you see, the thing here is
Nina, you can talk lah Nina.
yeah, you can talk.
Macam naik aeroplane.
Betul. Okay, so you see, this is wrong. No, cara pasangnya betul, dah inflate semua dah betul. But you want the patient to be comfortable, right? Including that one, same story. So yang ni jangan bagi dia balloon banyak. So kita tarik dia. Actually, doctor, can you help me? The strap tu can you bring under arm?
Oh.
Bukan. The sponge. The sponge ni must be under arm. Okay, this side as well. Okay, so kita tarik lagi. Okay, is this better? So the patient will be more comfortable.
Gambar. Boleh tak? Model.
I am flying to the moon. I am flying to the moon.
You alright?
Hashtag
Okay.
9:15.
Remove kan?
You want to release it?
You want to remove it?
Yes. Dia nak pakai lagi, saya pergi.
Remove.
Okay, you remove that first, betul. Okay. Yes.
After dry tak? Tapi macam bila dia remove dia punya ni rasa macam
Because of the peak, kan?
ya.
But could you actually feel the peak?
Rasa macam ada pressure. Tapi yang tu macam claustrophobic.
No, it's the same. The more sebab yang ni tak ada oksigen, dia macam ni. If dah kembang, dia kembang. Dia kembang. Tapi tak lepas satu.
Yang ni macam comfortable.
Okay? Any question on non-invasive? Just very quickly, I'm going to talk to you about an invasive stuff and then we're done. Yeah? Okay. So as I told you, I am an airway guy. Okay? So we started with glide scope a couple of years ago. Oh. I was wondering why there was no phone call. I had aeroplane myself. That's very good. I'm going to show you this video. So, this video was taken last week.
Last week.
Yeah. This while I was doing this, exactly same delay, same everything. Okay, while I was doing it, they had a call, E9, ruptured appendicitis. Okay, go into the emergency, and they were like, okay, got other, let's go in. Alright. So So this was an Arabic patient. We went in. This is invasive, this is a video laryngoscope. This is not Cpap. Okay? So you see, the moment we were ready, we went in. You see that? Nice? Done. Next door, what was the name again? Dr. Asli. She used this. She was challenging me. Okay? 14 seconds from introduction to insertion. 14 seconds. She turned on. Okay, all right. So I'm going to tell you what everybody tells you, but in a different way. Okay. This has got all the sizes. The smallest being Miller 0. I do not have a 00, but I have a 0. Okay? And then I have a 1 all the way to a 4, and I have a D. Now, usually a D would require special stylus. This does not require a special stylus. You can use your own stylus. Okay, I've tested it in Sungai Petani, it worked well. Now, what I'm going to show you and teach you today is this. Cara pasang is body to body. When I say body to body, this to this. Okay? And many people ask me, you want me to go down or up? If you go upwards, the patient is going to see the monitor. If you go downwards, you're going to see the monitor. That's only the difference. Okay? On, off. I'm going to definitely take this pen back one day. On, off is here. You press, dia akan on. Now, there is this button here. You tekan sekali, it will take a picture. Kita tekan 2 saat, this will change into a video mode. And then you press again, it starts recording. Oh, I keep on forgetting I'm on video. Can you hold it? Then it will start recording. Why is the recording important? Medical legal purposes, especially in the ED lah. Okay, here not so much. Okay, you start recording, you leave this on so that the anti-fogging mechanism works. I have got multiple videos to show you that if the anti-fogging works well, the intubation is going to go well. Okay. I've also had many questions where they ask me, kenapa benda ni tak kat sini? Okay, the only answer which I can give you is, kalau benda ni dekat sini, how are you going to intubate? Okay? Now, and another question is, kenapa benda ni tak ada kat atas ni? So, when we introduce a video laryngoscopy, you need to unlearn what we learned. A video laryngoscopy, you don't usually push the tongue. You go midline, because tongue is not an obstruction to us. Okay? We go midline. So, assuming the camera is here, the moment you introduce, the patient is seeing the camera. Everybody else is seeing the camera but you. Betul? Hence, this moves. You go in midline. The moment you are done, you do not go in full. You have to understand this, okay? The camera is here. If you see the vocal cord right here, there's no way you're going to intubate. Because the tube is going to go down. The tube is not going to go up. So when you use a video laryngoscope, midline, halfway through, lift. If you cannot see, go down, go a little bit more in, lift. It is not like our normal way of intubating, you know. It doesn't work that way because you do not have a direct view, then you're viewing it from here. And the camera is not your eyes level, you know. So that is why when you see the video tadi, the vocal cord is right on top. It is right on top here. Okay, so when you see right on top here, perfect position, you can go in immediately. You know, this is light, not very light as in plastic light. Okay, and after you use, close, soak it. Okay? Another bad point. I was informed by many doctors. You think my MS got time to take a close? Okay, many doctors told me that. So now I am telling everybody, okay, if you think you cannot afford to close this, what you do is lap je lah. Non-alcohol wipe. Do not use alcohol wipe. Reason, biofilm formation. When biofilm formation happens, the view is going to go kaput in the long term. And when biofilm formation happens, how does the anti-fogging mechanism work? Anti-fogging mechanism works via heating. And if the biofilm sits in front here, how is it going to get heated up? So there's no way, you're not going to see anything. Might as well you just go blindly. You know? So, advantages and disadvantages. Have a look at it, play around.
What material is this?
Apa dia? Titanium.
Titanium.
Titanium. You guys interested in the Miller Zero? Who wants to see the Miller Zero? This is a D, I believe so. This is a
Mana? Satu.
1. This is a 1.
Nak buka balik? Ayo.
Doktor nak buka balik Body to body. Doktor off dulu kat atas tu. Okay, and then body to body, just twist. Twist it.
To the right.
To the body to body. So kita will hold.
So boleh tulis kat sini apa ni?
Ah, wait, let me see. Cina tak tahu apa dia cakap ni. Bang. Kau ambil gambar hantar je.
Oh.
Balik lah. Ni betul balik? Tak tak.
Betul. So you see, when you put it here, lock, open. Betul.
Nice lah.
Nice.
Very nice.
Very nice.
Sebagai modern style.
Do you guys have any patient, any case, or all down?
No, but in the meantime already intubated.
Or intubated? If you got any, I'm happy to come in.
Yeah. You get the second one. Can you wait?
Sorry?
Can you wait? How long will you wait?
You tell me. Semua first case dah jalan kan?
You might be 11 or something.
11 something.
Yang target tracking case gynae.
Checking case gynae. Spinal tu?
GAG.
GA juga.
Kita 11 hari bulan CME kan.
11 hari bulan pun boleh. If you want pagi-pagi saya datang.
Kita try second case gynae.
Boleh. Okay, those of you online, thank you so much for joining. We are done here. All right, thank you so much for joining. Hope to see you soon. You can offer. You can offer. 15,000.